Good morning, everyone. Will Dupree here in the KXAN live studio. We're about to bring you a virtual announcement from the Austin mayor and Travis County judge. They're talking about extending the stay-at-home order for both Austin and Travis County. This also comes on the first day of another round of reopenings for businesses all across Texas, including salons and nail salons here in our state. Let's take a listen as this gets underway from both Austin Mayor Steve Adler and Travis County Judge Sarah Eckhardt.
My name is George Ortega, and I will be your moderator today. This news conference is to discuss an extension of the Austin-Travis County's Stay Home, Work Safe orders. With us here today are Austin Mayor Steve Adler, who will say a few words, followed by Travis County Judge Sarah Eckhardt. After which, we'll open it up to our pool reporter today, which is Phil Jankowski from the Austin American-Statesman. I'd like to now hand it over to Mayor Adler.
Good morning, Steve Adler. This morning, the county judge and I will be issuing new orders, extending the orders that were already in place. I think what is most remarkable about these new orders is that there's not much remarkable about the new orders. These orders are continuations in substance of our past orders, still maintains the stay home, work safe structure that is both in our orders and in the governor's orders. Really, the only change is we have now included the reopened businesses that the governor had included as exceptions to the general stay home, work safe issue. We continue to join the governor in urging everyone to stay home when they can, other than for essential work or reopened business or the exceptions. We join with the governor in urging everybody to continue to just be no big social gatherings, to stay at home with your family unit, household unit when you can, to continue the 6-foot distancing. We join with the governor in expressing the importance of wearing face coverings. As we know, the governor said that we couldn't enforce face coverings with a criminal or civil penalty in the city order. It's still mandatory. The penalty now is that more people will get sick and some of them will die if we're not wearing face masks. That ought to be penalty enough. At this point in the process, the governor, sooner than I would have liked and more quickly than I would like, is increasing the number of social and commercial interactions. When that happens, there will be an increase in the spread of the virus. There will be increased hospitalizations. Our purpose right now is to try and do everything we can to prevent a surge in our hospitals at a level that we're not able to deal with, and still give everybody the health care they need, not only the people with the virus, but people with a heart attack or an automobile accident that still need to make sure that there's room for them in our hospitals. We're going to do that 3 different ways. We're going to continue to emphasize the behaviors that we hope and trust that this community is going to follow: the 6-foot distancing, no big groups, staying at home where you can, wearing the face coverings. We're also going to do that by continuing to amp up the testing in our community so that we can find the virus when it's infected with someone just as quickly as we possibly can, so we can get that person isolated and treated. And by amping up the contact tracing that we do. We're going to need everybody's help with that, so that when we find an infection, we're able to get to other people that might have come into contact with that person. So again, we can contain the virus as best we can. At the end of the day, doing all those things, my hope is that frankly, we can make the governor's plan as successful as it can be. But if for whatever reason what we're doing now overshoots the goal, then this community needs to be prepared with the knowledge of what is the level to which we would reach when we need to take action. That trigger is something that the experts and the scientists are now working on. And the judge and I have asked them to come back and tell us and the community what is that level at which we need to take that action. We can all watch the numbers, see if we're approaching it, see if we reach that number so that we know when and if we need to act. My hope is that we'll be able to work on those triggers with other cities and with the state, governor, so that we're all prepared, as the governor said, for what happens if there's a surge. Again, I would just remind everybody that this RI virus is as infectious today as it was a month ago. It spreads quickly. Everybody should be minimizing physical interactions absolutely as much as they possibly can as we dip our toe back into increased commercial and social interactions. That's what this order does, is it tries to encourage everybody to remember the overarching message now is to still stay home and work safe to the fullest extent possible. Judge.
Thanks so much, Mayor. And I'm so grateful for your partnership. What the mayor said, nothing much is different about our orders that we put in place today, but things are very different in our community today. When the mayor and I first put our stay home, work safe orders in place at the end of March, we had about 100 confirmed cases of COVID-19 in Travis County. We had less than 10 people in the hospital with serious cases, and not a single person had died. We now have more than 2,000 cases. More than 50 have died. And since the governor has opened some businesses at the beginning of this month, we're hovering at about 90 people in the hospital. COVID-19 is not done with us. Our awesome community, oh, that's my awesome dog, sorry. Our awesome community responded quickly to flatten the curve. Even with nearly 100 people hospitalized, we're well within our ability to provide care. And if we had continued with business as usual back in March, medical science predicts we would have exceeded our hospital capacity by now. A lot more people would be sick and a lot more of us would have died. But we showed the love by keeping our distance. Our infection rate is 90% less than what medical science expected under business as usual. Our cases are still climbing, but for the last 2 weeks of April, our hospitalization rates stabilized at about 75 patients with serious cases. But we have to stay the course. Even as we venture out, we must keep limiting our person-to-person contact. Our lives or someone else's life depends on it. We've already seen our hospitalizations begin to rise again. We were stabilized at 75. We're now up to 90 or 95 on a daily basis. So every day, ask yourself, what's essential for me today? Who am I coming in contact with? How can I keep them safe? Do I know them and care about them enough to find them if I get sick so they can get tested? With that, I think we could take questions.
Okay, thank you, Mayor and Judge. I'll turn it over to our pool reporter, Phil Jankowski, to begin the question and answer portion of the news conference. Phil?
Okay, there we go. I'm unmuted. Hi, thanks for doing this. Yeah, Phil Jankowski here with the Austin American Statesman. Our first question is from Co-op Radio. They ask, is there not a more equitable way to distribute limited rental assistance than by chance through a lottery, referring to that city program?
You know, the question of distributing the assets equitably is something that we're trying to hone. We're also trying to get out the assistance as quickly as we can. And there's obviously a balance in that. But I know we have all asked that equity question, and to the degree we can do better, we will and we need to.
Also, Travis County is looking at dedicating a significant tranche of dollars from our COVID-19 federal allotment to put out through our community centers for rent and mortgage assistance. So we will continue to work with the city on mechanisms to get rent and mortgage assistance to folks as quickly as possible. As I said, COVID-19 is not done with us yet. So we will continue to look at ways that we can rapidly assist folks with mortgage and rent.
All right. Next question is from Community Impact. Do you expect a significant second spike in infections and another round of lockdowns? Are we prepared for that?
The mayor and I both asked the Chamber of Commerce to assist us in taking a look at and preparing for another red light. We're currently in yellow light, which is cautiously begin commerce. Both the mayor and I agree that we've not yet seen the statistics to indicate that we really should be in yellow light just yet. It was perhaps impetuous, but we are working with the business community to determine what it looks like if yellow light turns red again because of a spike. We are preparing our community for a possible spike that would require us to step back. The mayor mentioned we're both with our partners on developing triggers so that we can objectively warn the community we are about to hit a red light.
So we don't know the answer as to whether or not we'll get into another surge. The modelers tell us that if we drop, the judge pointed out that this community was able to get to a place where we had reduced the number of physical interactions, the virus transfer, by over 90%. And when you do that, the virus can't spread and you don't see cases, which was what we saw. Now that there's going to be more physical interaction, we don't know yet what that's going to do about virus transfer. We do know that if we drop below 80% reduction, then we're going to start seeing a spike and a surge. But we don't know whether the behaviors and the mitigation efforts that people are taking are going to keep us above 80% or not. And then to the question of what do we do, part of that depends on how far below 80% we are. Depending on how far below that we drop, we start having increased speed that we would then start seeing a spike. If we start heading to a spike really fast, really rapidly, then there may be nothing we can do other than returning to the lockdown that we were in. On the other hand, if the numbers are more gradual as it goes up, perhaps we start trying other mitigation efforts to ramp up. We don't know the answer to any of those questions, either does the governor. And that's why we are all leaning so heavily right now on reading the data and the work that's being done by the scientists and the doctors.
All right, next question from me, American Statesman. With the governor's orders in place and his decision to basically suspend bits of the local government code and prevent you guys from issuing certain aspects of emergency orders, why do the two of you feel a need to continue to issue local orders like these, and where do these orders go beyond what is in Abbott's latest orders?
I think that for me, the reason it's important for the city to have orders is because the law allows us to, so long as it doesn't conflict with the governor's order. And in our case, we have provided additional direction to our community on the things that they should be doing consistent with the governor's order that give us the best chance to avoid an abrupt surge. For example, the governor said that construction activity, all kinds of construction would happen in the city at a time when we had limited construction activity. We changed our order to say, okay, construction activity can go, but we also then put into our order certain mitigation rules that are required to be followed on construction sites to minimize as best we can the transfer of the virus. So we have those kinds of rules, the kinds of recommendations that the governor made in terms of mitigation behavior with different reopened businesses, we've made mandatory in our city because we've wanted people to not only take them as recommendations, we want people to do them because the governor is proposing them for a reason. And we want to make sure that as many people as possible do them. I also think it's important from a messaging standpoint. And the mask is a good example of that. I don't want people to hear the governor say that there's no criminal or civil penalty for face coverings and think that they don't need to wear them and they shouldn't do them. I was concerned this weekend to see how many people were out and about not wearing face coverings, that were together in the same place not wearing face coverings. And as the judge said, you know, wearing a face covering is probably one of the most selfless things you can do. Wearing a face covering does not protect you from getting the virus, but what it does do is it protects the people around you. You know, we have clerks in stores. Now we're going to have people cutting hair and taking care of people's nails. Those people need our protection. The people on our streets need our protection. And so it was important to have an order, I think, that kept that issue front and center, so as to really see if we can get our community to do all of the mitigation steps that are recommended.
That was my son and my dog in the background. I'm sorry about that. Let me just put a button on what the mayor was saying. The community trusts and expects the mayor and the county judge and our Austin Travis County public health professionals to give them the best medical advice about how to keep us safe in our homes and at our work. And we will stay at work providing that trusted advice. So even if we can't enforce it with civil or criminal penalties, still the community is wanting to hear from their Austin Travis County Public Health Department what will keep them safe, what will keep their neighbors safe, what will keep them safe. And we're going to keep giving them the best, most reliable advice that we can.
All right, next question from Fox 7 Austin. How long is the order extended to?
Our order goes until the end of the month. And I think that was important for us to do because of some of the deadlines we've extended in the city. So as a practical matter, it's going to require us to come back in before the end of the month, change the order. Obviously, we know the governor's order goes through, I think, the 19th of May. So it's entirely possible that we could be taking additional steps before the end of the month. And in the work that the judge and I are doing, trying to get a trigger for the community, it's possible we could be back in with a supplemental order before that time as well. But for now, the horizon in our order goes to the end of the month.
And frankly, we wiggled back and forth. And so I was just trying to pull mine up to see if we ended up going to the end of the month along with the city or if we stuck with June 15th. So I'll take a look. That was a last minute change.
Okay, if you can just let us know once you find it. We'll move on to the next question while you're looking from CBS Austin. Both the mayor and judge have talked about a certain number of hospitalizations, giving y'all sort of a heads up that the community is spiking. What is that number and how much of a heads up would we expect in that case?
I don't think we know the number yet. That's why we're asking the scientists and the doctors to tell us, the modelers. I think that they're getting close to be able to lay out that for the community. My hope is to get this information and data to the community just as soon as the judge and I get it, so that it's transparent and everyone can see it. My hope is that everybody sees these numbers well in advance of us beginning to approach them, so that we can, as a community, see if we are approaching them, or maybe we're not approaching them, so that everybody can follow along. So I think it's just important for us to get that out just as quickly as we can. But you don't rush the scientists and the doctors, because you want the best possible advice for our community. And as the judge said, I think it's our role to a large degree in just trying to get as much sound medical and scientific data and advice as we can to the community.
It is June 15th in the Travis County order, by the way. And also, I'm going to go through some simple math because I can't do really complex math, but just as an example, we don't yet know, and we are relying on the experts, and that's a good thing because, like I said, I'm pretty good at math, but not as good as they are. But we had 10 hospitalizations at the end of March when we put Stay Home, Work Safe in place. We have nearly 100 hospitalizations today. So we have roughly 1,000 we have the capacity for about 1,000 hospital beds for COVID-19 at surge. If we really, got out there and surged by pulling up more hospital capacity. That's not exact, but it makes it easy for math. If we had 10 at the end of March, 10 hospitalizations, and we have 100 hospitalizations today, which is a little bit more than we have, and we have 1,000 beds, and we're doubling every 20 days, even at 90% reduced person-to-person contact. Just run some simple equations in your head about how quickly we could dip beyond our capacity to provide adequate health care to our community. That's what we're dealing with. But we're going to rely on medical science to give us the best trigger that we could possibly use to inform the community.
And understand too, that was a great example. And I love the numbers you used. Don't forget there's a 2-week lag period of time. So we need a trigger that backs up in time, that recognizes that even if we shut down on day 1, we're not going to see reduced infections from that until 10 to 14 days thereafter. That's when we would see it. So the physicians have to, and scientists have to take into account not only what we don't want to exceed, but what is the timing for us to react to make sure that we don't exceed.
Okay, next question from KXAN. Has the city, and we'll go ahead and extend that to the county as well, laid off or furloughed any workers since the start of the COVID-19 pandemic?
The city has not and has no current plans to do that. We were fortunate to have really built up reserves in the period of time over the last several years. In fact, we had reserves that exceeded our policies required us to have. But we're continuing to study that. And we're going to have to play that by ear to a degree as we see what it is that this virus brings to us. What we have now is on the 21st of this month, the city manager will be coming to the council to talk to us about what the budget might look like for all the federal money that's coming in. And that will necessarily include a conversation about how much money, if any, we're going to have to hold for revenue replacement. And frankly, what we have to do to fight the virus and to make sure that everybody is fed and has a home is going to tell us in part how much money we have to replenish the revenue that we're not getting. So complicated answer to say no plans at this point to do furloughs or layoffs. And we're fortunate because a lot of cities around the country are doing that now. But we'll continue to play it based on the data and the facts as they develop.
Travis County has declared a hiring freeze. We've not laid off or furloughed any of our employees, but we are taking a very careful look at our budget, as I know the city is as well. COVID-19 is a threat to our health and a threat to our economy. Local government relies on sales tax and property tax. The sales tax is very volatile. So we are being very, very careful. And we want to be good partners with the city that has a larger reliance on sales tax. Travis County doesn't have access to sales tax. We also must recognize that the federal dollars are one-time dollars. They are not ongoing dollars. They replace our immediate one-time investment in response to COVID-19. They don't replace ongoing revenues for our personnel. And this is going to be a very complex economic recovery for everyone in the public sector and the private sector. So we are engaged today on our response to the economic recovery from COVID-19 as well. It must absolutely be a parallel track.
Okay, next question from KUT. What measures are being taken to address COVID-19 cases at elder care facilities?
Lot. Right now, we recognize that the facilities, nursing homes, and other elder care facilities are some of our greatest susceptibilities and vulnerabilities. This is a cruel virus, and it picks out the people that are most vulnerable. So we are trying to isolate as best we can the people that are living in these facilities. We have facilities to remove them if they're infected and to isolate them. But you always can't do that with that population, because sometimes that population, some of its members, really need to be able to stay in a place that they know. We're trying to increase the staff and help. We've established some strike teams initially with the state, and now that the state's moving those strike teams away, we're backfilling them. We are doing increased testing in these facilities so as to get a landscape feel for what we're seeing. And our city council yesterday at the city council meeting passed a resolution directed entirely at these facilities and amping up the resources and attention even beyond the already amped up place and the attention that these facilities will receive.
Nursing home facilities are regulated by the state. And we do rely on the state to set standards for the nursing home facilities in blue sky days, but also certainly in times of crisis like COVID-19, where we have a virus that does prey upon those who are over 65 in a terrible, terrible way. So we are looking to the state for their assistance in these communities. We are investigating clusters, I believe, in 16 nursing homes at this point. I think often about my mother who died last year in hospice and how difficult it is for people to die alone, isolated cruelly by COVID-19. I can't imagine what it would have been like to not be able to visit my mother as she died. So we must curb the viral spread of this COVID-19. It's tragic to think that we can't be with our loved ones, even as they pass. So we will really, really bear down on the nursing home issue. This is tragic beyond comprehension.
Next question from from KView. So what has changed today? We heard discussions of businesses keeping logs. Is that happening?
You know, again, the real story is that things have not changed. We need everyone to stay home and isolate and avoid large groups and do the physical separation and the face coverings. The real story today is that things have not changed because there are a lot of people in our community that think somehow or another things have. All that's happened is we're reopening some additional exceptions. And I think that's really the big story. I did put in the city's order a recommendation that businesses help assist with contact tracing in the city. I did mention keeping logs in restaurants, not mandatory, just something that we're asking for facilities to do as they're able to do it. But that just makes sense. If someone has an infection and they were in a place that I was in, I would want to know. And I would want people to be able to find me quickly and let me know that I may have been near somebody that had the virus. You know, we're in a world right now where most of us could probably tell you everybody that we had been near over the last week by name, by day, because we've been around a limited number of people. But to the degree that with the with the governor opening up new businesses, we're going to be in and around people that we don't know. Everything we can do to help the contact tracers recreate who was where when is something that we want, but nothing mandatory at this point, just a request for from Austin Public Health for assistance.
Next question from Telemundo. The RISE funds have run out at certain organizations like El Buen Samaritano. Are there talks about any other support for the undocumented? What about other agencies that didn't get any funding through the RISE fund?
Travis County is looking specifically at making investments for, we've already established a $10 million pot of money for small business grants. We will be establishing another pot of money for mortgage and rent assistance, and then yet another pot of money for nonprofits, so that we can make sure that our nonprofits engaged in direct services to folks at the margins stay up and running and healthy and providing those services. Travis County and the city of Austin, we don't care where you were born. If you need help, we will provide it. So irrespective of where you were born, we want to be there to help everyone survive medically and economically from COVID-19.
The judge's answer is great on that. We're doing the same kind of things in the city with not only the RISE fund, but with subsequent actions, money directed toward the artist community, which are also hard hit. Also with the business loan programs and the probably 7 or 8 resolutions yesterday dealing with nonprofits and the like. But the truth is that we're not going to be able to make everybody whole. The damage and the wake of this virus is too great. We're going to have to do the best job we possibly can of helping and assisting one another get through this together, recognizing that this is not going to be over quickly. We're in this for the long haul, and we're going to have to take limited resources and send them out to the community in the best, most equitable way we possibly can.
Okay, next question from Co-op Radio about the rental assistance lottery. Are veterans getting any preference in the lottery, such as partial set-aside lottery specifically for veterans? If not, should veterans be singled out now as they have been in the past?
The truth is, I don't know the answer to the question on the details of the lottery issue. I made a note of it with Co-op's initial question, which was the first one we had, about should it be more equitable than just a mere lottery. I hope that it is more equitable than just a mere lottery, but I made a note to check on that. I don't know the answer to the question, but if Co-op would follow up with Gloria in my office, we will get an answer to this question, or with PIO.
Also, the City Housing Authority and the County Housing Authority, they're separate entities authorized by federal law. The city appoints the board to the Housing Authority, as does Travis County appoints the board to the County Housing Authority. But the distribution mechanism is, I believe, is made by the executive director in collaboration with his board.
Next question from Community Impact. We're at 1,000 tests per day across the community. Can you outline the barriers in place keeping us from reaching a recommended testing capacity of 2,000 tests per day?
There are several limitations on tests, and one is the accessibility of the test itself. There still are not enough tests to go around for everybody. It's not just the test, then it's the medium. It's just not the test and the medium, it's the swab. One of the issues with respect to tests is the timing that it takes to get tests back. Different labs have different time periods. So there are some tests we might be able to access, but might not be able to get results back for 3-4 days. So we're trying to access tests and find suppliers that will give us tests more immediately. We are in the process of coming up with a greater strategic plan for testing. So as we go into this new world of increased social and commercial interactions, to make sure that we have an overall strategy that takes into account not only the testing technologies that we have been using, but trying to determine if there's an appropriate place for serum testing or antibody testing, which heretofore hasn't made a lot of sense yet, just because of our infection level within the city, together with the reliability issues associated with that testing. So right now, we don't have more tests because there are not enough tests to go around. But I would point out that we have greater capacity to give tests than we have people signing up for tests right now. So I would urge everybody, if they have the least inkling of a symptom, to go online anywhere in the county, in the city, to go online. There's a free assessment. If you qualify for a test, and they're moving down the barriers for people being able to qualify for the test, because we have that testing availability. It's a free test. You can sign up. You get a set time to show up to take the test. But right now, we have greater capacity than we have people signing up for tests.
I just want to give a big shout out to Austin Travis County Public Health and to community care under Central Health. Our ability to ramp up the amount of testing we have is because of just a tremendous effort from our public health professionals, as well as the hospital district and public clinic system. It's been a pleasure to see them pull up a testing platform so quickly that actually that testing platform has been adopted by the state for a statewide platform so that people can get assessed and get a test if they are exhibiting symptoms or have been in contact with someone who has tested positive. It's just, I'm honored to have been part of this team and to see this fine work.
I think you already touched on this a little bit earlier, but here's a question from American Statesman, great news outlet. Governor Abbott has removed many tools to enforce orders like this. How does that restrain your ability to enact social distancing mandates like this?
You know, this thing has never been about being able to enforce anything that way. There are not enough sheriffs or police officers to put people in jail. From the very beginning of this, the judge and I have been really consistent in talking to the community. This is going to work or not work based on what the community does through individual decisions, collectively creating what it is that is the community response. It's what we hold each other accountable for. It's the behaviors that we expect of one another and expect of our retailers and our businesses. It's what they expect of us coming into their stores or their shops or their offices. We have done a really good job in this community. And our response to this has been overwhelming. But it's been something that's been driven by each of us. And I hope and pray that we maintain that discipline and that resolve.
Okay, next question from Fox 7. Can you clarify for residents what orders need to be followed? The governor has issued his orders. Should the state's orders supersede local orders?
Yes, everyone's a little confused. I completely understand. That's the reason why the mayor and I felt that it was important to go ahead and put out these orders to clearly state, yes, the governor's orders are controlling. They are. But the recommendations of your public health professionals has not changed. The recommendations of the public health professionals remain: only do what's essential during the day, only come in contact with the people who are essential today, know them, care for them, by wearing a face mask when you interact, keeping 6 feet of distance, washing your hands, staying home if you can, and at the workplace, make sure to work safe. The recommendations have not changed. Some businesses have been opened by the governor in an incremental way. But other than that, the recommendations of your public health professionals has not changed.
There is no conflict between the order from the governor and the orders of the county judge and myself. There is no conflict. So everybody should be following all of the orders that pertain to them.
All right, next question from CBS Austin. Is there or will there be relief for small landlords who rely on income from a couple of rental properties and are not receiving rent or rent payments that are unpredictable? For example, retired people who supplement with rental income, or residents who perhaps have moved but are paying the mortgage on property with rent money. Examples to basically, we're looking at examples to differentiate between large owners, corporate owners, and relief for small land owners of few rental properties.
Travis County's program for mortgage and rent assistance has, as would the city's program, have a double benefit. First, it frees up money for the individual, the renter, in order to pay for other important necessary items. But it also does help that small landlord who maybe has a small number of units, or maybe is renting a garage apartment. So every rental assistance to those small unit landlords is a benefit to both their tenants and to the property owner.
And we're following that lead as well with the programs that we're doing in the city. I know that yesterday I extended the ban or prohibition on filing notices of eviction. I think the county judge has or is doing the same thing. The city council passed a resolution yesterday extending a grace period. Rent still accumulates, but you don't have to pay it and face eviction. We did that because we didn't want anybody in our city out on the streets. But as the council discussed yesterday, we need to make sure that we're actually focusing as well on those small landlords that are also the victims of the economic wake of this virus. So we, as we discussed yesterday, are going to take a renewed look and another look at trying to help those folks in addition to the programs that the judge was describing, the rental assistance programs that actually get rent paid so that a landlord can receive it.
Okay, just 3 more questions left. This one from KXAN. Are there talks of any support that will be offered for childcare workers who are not considered essential? If so, what are those plans?
That is something that we must focus on. Absolutely. I was in discussions with our workforce solutions folks just yesterday. Currently, state supports for childcare only go to childcare for essential workers. I'm going to look into suggesting to the governor and to the Texas Workforce Commission that we expand childcare supports for all workers in opened businesses, whether they are classified as essential businesses or not. That is definitely something that we need to look at. Folks are concerned about opening up their child care businesses, and we also need to work with those business owners in the child care industry to make sure that they feel that they've made the adaptations in their child care facilities that keep them safe, their employees safe, as well as the children and those children's families safe. We have seen some early evidence in testing across the nation indicating that people who work in the pediatric field have a higher infection rate among medical professionals than those who work in other fields. That is at least a strong inference that that because children are not exhibiting symptoms does not necessarily mean they are not shedding COVID-19. So we need to be very mindful of our daycare community, the industry, as well as the clients of daycares, that we make sure we have adapted in ways that keep our community safe. We completely recognize it's very difficult to open up businesses when people have their kids at home because they can't have them in a daycare or at school because they're closed down. We've got to find the right balance. We absolutely must, and we are committed to that.
Judge, that's real important work. I have no better answer to that question. I would point out that with the unemployment insurance direction that came from the governor's office at the end of last week, if someone is called back to work in a non-essential place and there is no child care that's available to that family, that is a valid reason for someone not to go back to work and still be entitled to receive unemployment compensation. It is not a substitute to actually having child care, which is why I go back to the answer that the judge gave, but I did want to point that out.
I do want to give a shout out to the Texas Workforce Commission in that policy. It's been, they are wonderful partners, and we've been working very, very well with them.
Okay, next question from KUT. What sort of discussions have y'all had with state leadership on this order?
I had the opportunity to be on a couple of phone calls with the governor, together with all of the other mayors and county judges in the state. I think were also on the phone call. I did have an opportunity to speak more intimately with James Huffines and Michael Toomey, who are the two folks that are running the governor's task force. And I had the opportunity to be able to speak about the trigger concept, as well as the additional support that we really need on testing and on contact tracing. And they were very open to the conversation.
And I have spoken with Dr. Hellerstadt. I've spoken with Senator Watson, who's on the task force, and have also traded some phone calls with the governor's chief of staff. I too have been on the phone calls. We remain in partnership, looking for appropriate and predictable triggers for how to balance between our health recovery and economic recovery from COVID-19.
Okay, last question from Telemundo. You're extending the order in place until June or June 15th for Travis County. What will those restrictions or enforcement look like when it comes to public spaces like parks, lakes, churches, and restaurants? A lot of holidays will take place during this second extension. And also, do you believe that these orders might be extended again?
With regard to properties that Travis County owns, we will certainly limit access to those properties in order to be able to maintain social distancing, absolutely. But into private properties, we will be able to caution folks. We would certainly provide warnings to individuals if a neighbor is concerned about what's going on in a property next door. We will certainly come out and provide the best information that we possibly can, and strongly urge that they comply with the recommendations. But as the mayor aptly pointed out previously, there are not enough sheriff's deputies and police officers to enforce on gatherings countywide. We've simply got to care for one another and encourage each other to not gather in large groups. It is just too dangerous, not just for the people involved in the gathering, but also for everyone those people come in contact with after that gathering. The virus depends on us to move through our community. The more people we come in contact with, the higher the probability is more people will get sick and more people will die.
Let me just, as a postscript, add to what the judge said and talk about churches directly to Telemundo here. You know, there is risk associated with large gatherings just because there's going to be more physical interaction. We can try to mitigate these as best we can, and it's good when we do by sitting in every other pew, by making sure that families enter one at a time, by making sure that we disinfect anything and everything that anyone could touch before anybody had a chance to touch it a second time, by limiting the total number of people so that if there's any contact tracing that has to happen, we're in a better position to do it. All of the things that are really important things for us to do. And our policies here in the city and in the county follow the mandate that came from the governor's office as he has reopened churches with the limitations that the governor had imposed. But I would urge churches a couple of thoughts. The first is most of the churches, most all of the churches, we're doing such a wonderful job of telebroadcasting services so that congregations could be together remotely and virtually. And I hope that that practice continues and that everybody who can will avail themselves of that opportunity, because that's the safest thing to do. I recognize we have some churches that are now opening for their congregations in limited ways, and I want you to know I greatly appreciate, as does the judge, all the limitations that are being self-imposed. Maybe that even go beyond what it was that the governor suggested and we're requiring if the governor suggested it, to go past that, to be innovative and creative, to think through how best to protect the members of the congregation, as well as the clergy that are going to be there with the congregation. And then I would conclude with, and here's the hard one, anybody over 65 should probably avoid going to a church service in any kind of group. We really need to protect people that are the most vulnerable. People over 65, people with diabetes, people that are obese, people that have lung conditions or heart conditions. There's such a risk associated with going to a church gathering like that. And I would really urge people, my parents aren't here any longer, but if they were, I would try really hard not to let them go. So I just add that postscript thought.
That's the end of our questions. So any final thoughts from you guys?
I don't have anything else to say.
I'm just going to say, show the love. Just show the love, y'all. Consider, what am I going to do today that's essential? And only do that's essential. And who am I coming in contact with? How can I keep them safe? And do I know them and care enough about them to go find them if I get sick so that they can get tested? So show the love, y'all.
Judge, thank you for what you're doing.
Thank you for what you're doing, Mayor. It's a pleasure working with you.
Absolutely.
Great. That concludes our press conference. I'd like to thank our speakers once again and our pool reporter today. Thank you, everyone.
Thank you.
Thank you.
Will Dupree still here in the KXAN live studio. We've just concluded a virtual press conference that Mayor Steve Adler and Travis County Judge Sarah Eckhardt held to explain why they're extending their stay-at-home orders. What I will say is that they pointed out this does not at all supersede what the governor is doing in terms of reopening businesses. We know today that even more can reopen their doors. That includes salons and nail salons and barbershops. and places like that, they can reopen at 25% occupancy today. What the mayor and county judge said they're doing this is that this is to at least still encourage people to practice safe physical and social distancing, along with encouraging people to wear their face mask still, because this virus is not gone yet. That cannot be underscored enough, is that this virus is not contained. The pandemic still exists for our county and for our country and for the world. So that's why they were extending this. For Austin, the order for stay at home and work safe is extended until May 30th at midnight. So basically May 31st, we should just say that. For Travis County, it's extended until June 15th. Unsure why the discrepancy in the dates there or the difference, but we'll ask about that too. Again, what these orders do is they define essential activities and businesses, and they make note of the now reopening the businesses that can do that safely at this point. And it encourages people to only do essential activities or essential business still. No big social gatherings. Continue 6 feet of social and physical distancing. Encourage face coverings. However, both the city and the county cannot render any criminal or civil penalties for people who don't follow that particular guidance after an action that the governor took fairly recently. I'll also say that looking at the city's stay-at-home order, it's saying that restaurants that offer dine-in or reopen services, they conduct logs for customers to be able to do better contact tracing in case someone who goes to one of those places ends up testing positive for COVID-19. And then they can reach out to people who were maybe interacting with that person so that they can get tested as well to be able to protect themselves. Again, that is a voluntary thing, but the city is encouraging restaurants who offer dine-in service to be able to do that. And they also make sure that privacy protections are in place so that these logs will not be made available to anyone other than to public health officials to be able to contact trace with that. Regarding numbers for our county, if you want to take a look right here, we crossed into the 2,000 mark last night. 2,002 positive cases have been confirmed so far in Travis County. 59 deaths, so 2 more in the last day. We want to point that out. There's also on their website information about recoveries, and I'll point that out too once I pull that information up. 659 people here in Travis County have now recovered after receiving a positive diagnosis for COVID-19. Currently, though, 91 people are in the hospital, 32 in intensive care units, and 17 are now on ventilators fighting the disease caused by the novel coronavirus. In our area, these are where the case counts stand at this point. There in Travis County, 2,002 confirmed cases. Just to the north, Williamson County stands at 352. Hayes County now has 202 positive confirmed cases. They also reported an additional death within the last day. So 2 people have now died in Hayes County from COVID-19. Once again, I'm Will Dupree here in the KXAN live studio. Thank you for watching for as long as you have. This was a rather lengthy stream because they were answering a lot of questions from the mayor and the Travis County judge of reporters here in our community about these new extended orders. We'll highlight again that the one for Austin is extended till May 31st. The one for Travis County is extended until June 15th. They are encouraging people to not gather in big groups. They're saying to maintain that 6-foot social distancing whenever possible, and to encourage you all to still wear your face mask when you go out in public. That's not only to protect yourself, but others, because people can not show symptoms at all, and this is a way to do that. Thank you all again for watching. We hope that you all stay safe and healthy, and if at all possible, still at home. Thanks again.